See, the thing is, asymptomatic person, we will call the person who is like, they were trying to travel somewhere and they got the COVID test by chance and they got positive and they have absolutely zero symptom. The point you were trying to say about differentiating, no, they have absolutely overlapping symptoms. In
Right.
flu also, you can get high fever, and COVID also, you can get high fever. So it is very important to wear a mask, social distancing and sanitizing, and not touching your eyes, nose, mouth, anywhere. Keep it
Right, doctor.
sanitized. So basically, how the pandemic will shape up depends upon the people behavior.
Hi, this is Toshi, and you're watching India.com and the health site. So recently, we've seen a surge in the number of Omicron cases, not only in India, but across the world. In wake of which, a lot of states have put in curfew-like restrictions to curb the number of cases. Well, today we have with us Dr. Shalini joining us from Fortis Hospital to make us aware about the new strain of COVID-19 Omicron. Welcome, Dr. Shalini, to India.com and the health site.
Yes, thank you so much for inviting me. Let's go ahead.
Yes, doctor. So first of all, we've seen in the recent cases that, the Omicron, the symptoms of Omicron are very similar to a common flu or cold. So can you list down the symptoms to us, and how, if they are very similar or if they are very different, what are they?
So basically, I would not share that message that if these are the Omicron symptoms and if you have this, you have Omicron. If you have, no, it is the same virus. It would have very similar symptoms.
Right.
Just by looking at the symptoms, there is no way to differentiate. You have to, if you have any fever at this point in India, and you have little bit of cold, cough, no, you have to isolate yourself. That is the first thing I say always. Not go to a doctor. I say, if you have any symptom, go to a separate room and isolate yourself. Then do a video consultation with the doctor, and then if the testing is required, people come home to get a testing done. So basically, you have to be very what should I say, imandar meaning like you have to be very honestly identify a symptom and isolate yourself and get yourself tested, and prevent your family to get it and your friends, and you have to inform your friends if you were with somebody, and then you have to inform your apartment if you are living there. So that is your responsibility to do your part, and that's the way we can control the spread.
Right, doctor. But is there any similarity between the flu and the symptoms of COVID-19 Omicron? How can we differentiate? Is there any point of symptom, anything that would help us differentiate? Because we're seeing most of the cases in the country are also asymptomatic, and other than that, they only have little mild symptoms.
See, the thing is, asymptomatic person, we will call the person who is like, they were trying to travel somewhere and they got the COVID test by chance and they got positive and they have absolutely zero symptom. That person is called asymptomatic. Now, if somebody had come from Goa and has little scratchy throat and have a headache and back pain, and even they don't have fever, they have to get it tested, because COVID-19 or Omicron, it is not that you have to have all the symptoms to say that I have a COVID-19. The point you were trying to say about differentiating, no, they have absolutely overlapping symptoms. In
Right.
flu also, you can get high fever, and COVID also, you can get high fever. You can get a scratchy throat pain in both. You can get runny nose in both. You can get cough in both. So and body pain in both. So there is absolutely overlapping symptoms. So it is very important to consult a doctor, get it tested appropriately, and get the right diagnosis and get on the right treatment.
Right, doctor. Also, we've seen, as per the studies, as per the data that has come in until now, that, the Omicron is not specifically affecting the lungs to, in death or something. And also, we've seen that, a lot of beds are not occupied as of now. So, what is the conditions in the hospital as of now, if we say, because, there's a lot of panic about this, if you can clear this for our viewers?
So basically, with Omicron, there is nothing to panic. It is the same COVID appropriate behavior. If people follow, it would definitely decrease the transmission from person to person. Yes, I agree. There is a lot of pandemic fatigue. What we say is like people are so tired of doing the isolation and not going anywhere, that people have all come out in herds, like you saw the pictures of Baga Beach in Goa. What happened should not have happened, but it has happened in Europe also after the Euro Cup, and there were thousands and thousands of cases. So basically, how the pandemic will shape up depends upon the people behavior.
Right.
And it is not possible to have so many crores of beds ready for patients if in case they need. It is the people behavior which is going to decide if they are wearing mask. And believe me, this is N95, and if it is worn correctly over the nose like this mask doesn't differentiate if a Omicron is entering or Delta variant is entering. It will protect you from both. And
Right.
the third and the fourth, no matter how many variant comes. So if
Right.
you wear an N95 mask, if you're going to a very crowded place, or a surgical mask, double masking, it will definitely save you. Booster dose will come when it comes. So first, the booster dose will be given to the children, to the healthcare workers, and above 60. So instead of waiting for the booster dose and thinking, and people think that they have taken 2 shots, they cannot get infected. That's a wrong way. I have gotten 2 doses last February. I am still wearing N95 all the time. So it is very important to wear a mask, social distancing and sanitizing, and not touching your eyes, nose, mouth, anywhere. Keep it
Right, doctor.
sanitized, and not touch the outer surface of your mask. If you have to take it off, take it on. You have to touch the strings. It's very important to know how to wear a mask and how to care for a mask.
Also, doctor, we've seen that, recently, in fact, today, a medicine of Dr. Reddy's has been approved. What do you think that, such medicines would help us take over COVID, or will that be used in the treatments at hospitals as well?
I think you are trying to discuss about an antiviral medication. So
Right.
we have been using an antiviral medication, by the way, which is very different from the influenza treatment.
Right.
There was some confusion with some patients start automatically self-medicating with the flu vaccine. This
Right,
is
right,
not correct. It is not a flu vaccine. This is a totally antiviral against, it works against COVID also.
right.
We've been using another antiviral, and the second one, which is already approved by FDA in US, and it has been launched in India, has been approved with DCGI and is currently available. And yes, I have been using it for last few days since it has been available as an antiviral, because studies have shown if started very early in the disease, very early, I'm talking
Right.
about second, third day, it would be antiviral and it can kill the virus. So let's see, we have limited data all across the world, but yes, I've been using it.
Also, doctor, my last question to you would be that, recently we've seen that, do vaccines have a shelf life? Because, a lot of things that come in that, the co-vaccine, which is being administered to, students, the teenagers between 15 to 18. So there was a limit, and the co-vaccine was supposed to, expire in the month of November. But, they've increased the shelf life. So what exactly is the shelf life of any vaccine? If you can just give a gist on that.
So basically, like I will explain you with an example of a medicine. So the medicine expiry date is written. So it is not that the expiry date, which is written on 30th of December, it's not going to work on 1st of January, like the next 2 days. So it is never like that. It is just a general idea that, it is the expiry date. So scientifically, the vaccine, I mean, every vaccine has their own, scientific data. But I think proper guidelines have to come from the center and the vaccine manufacturer if it can be extended. And I'm sure if everybody is ready to take the vaccine, we will not have the stocks of vaccine sitting. So people would be open to the idea of taking the vaccine. So whatever vaccines are manufactured are given to the to the public, to the healthcare workers and over 60, so we can use it as a booster dose. And first time users, especially adolescent and teenagers, should also take the vaccine, because India has been producing vaccine for the entire world. Just to make a fact straight, that India supplies 65 to 70% of the entire world vaccination demands. So India is a pioneer, so we should not doubt the vaccines which are made in India.
Right, Dr. Shalini, thank you so much for taking out time for India.com and the health site, and explaining our viewers and clearing all the misconceptions regarding the new variant of SARS-CoV-19, Omicron.
Thank you so much, and I will leave and I'll put my mask on again.
Yes, thank you,
Bye-bye.
Doctor. Thank you so much.